Oftentimes, sleep apnea and COPD can coexist together. There is an overlap syndrome that we're now actually beginning to recognize and understand that there could be some groups that have a higher prevalence of both disorders occurring together. Sleep apnea is when we stop breathing for short periods of time when we're sleeping at night. The most common is obstructive sleep apnea, and this happens when your upper airway narrows and there's a limitation to the airflow that happens in the airway. These cessations to breathing are very short-lived, and our brains biologically wake us up. People who have COPD, they already have a lung problem, right? They have a limitation with the function of their lungs, and it becomes even harder for them to breathe at night, so they can actually be more breathless and more fatigued overnight when they're sleeping. Usually you're not aware of this happening, but bed partners might notice that somebody's snoring, that their chest is actually not rising as one would expect with every breath. If you're concerned for sleep apnea, ask your doctor. Usually your doctor will refer you for further testing to diagnose any kind of sleep apnea. It's a sleep study that could either be done at home or it can be done in the lab. And then depending on the type of sleep apnea and the severity of sleep apnea that is diagnosed, that's when we can determine the type of treatment that is appropriate. The most common way that sleep apnea is treated is with PAP, which is positive airway pressure, more commonly known as CPAP. This is a mask that's attached to a machine that's delivering pressure to the back of the airway and acts as a splint. So that narrowing that normally happens in sleep apnea is actually eliminated because of the pressure splint that the machine provides. Sleep apnea definitely can be a scary diagnosis, especially when people hear that they stop breathing at night. But what's important for people to remember is that our bodies are designed in such a way that we will always wake up from the blockages to breathing.